Bubbles is a 7-year-old male domestic shorthair, and he came into the vet to get a routine yearly wellness exam. We brought Bubbles to the treatment area and we drew blood from his back leg, in which case we scruffed the neck and put them on their side and kind of do a karate chop to the back of the leg just to hold off the vein. That way the nurse can draw the blood from the back leg. Bubbles reacted pretty normally. Once we got the few drops of blood, we were able to run the SNAP test, and Bubbles was negative on both FELV and FIV. We brought Bubbles back into the treatment area, wrapped him up in a towel so he could be a little bit more immobile, and we proceeded to clean his ears from there. And that basically entails using what's called a malicetic cleanser, which is veterinary ear cleaner. And we poured that into the ear and scraped out all the gunk out of his ear with cotton balls and Q-tips. So when we were cleaning it, there was a little bit of blood and brown gunk, and that's pretty standard if a cat has a bad ear infection or has ear mites. That's pretty common to see, and that's why we go ahead and clean it out for them, even though they put up a fight and don't like it, but we want to make sure the cat no longer has an ear infection. So Bubbles had his 3 years rabies vaccines. He also got FVRCP, which is pretty much a kitty distemper shot that helps prevent for the common kitty cold. Bubbles got the FELV leukemia shot, which helps protect against feline leukemia, and we gave that to him because he's an outdoor cat. Usually it's okay for the nurses to administer the shot. Sometimes if the cat or dog kind of puts up a fight, we prefer the doctor to do it just in case, to be safe. We bring them back into the room and we kind of go over what we did to the owner so they understand. We also show them their ears once again and explain to them how they are going to have to be administering the medication over the next few days to help eradicate all the ear mites in Bubbles' ears. And we set up a follow-up appointment with Bubbles so he could come back so we could check the ears and make sure that he no longer has an infection and all the ear mites are gone. We had given Bubbles' owner 2 fecal containers, and that's to collect a sample, and then we will wring them out. And the typical wellness exam for a cat would be looking at about $150 or so. Bubbles was a great cat. He was a great patient. We were sad to see that he had an ear mite infestation, but generally those clear up 99% of the time with the medication given. And the next time we do a recheck on Bubbles, we would hope to see no more ear mites and that his ears are all cleaned up.